Hello, everyone. I'm Susan Cole from Phoenix Health Movement.
And I'm Denis Onyango from African Advocacy Foundation.
And welcome to Positive Health, the live broadcast series focused on HIV and the pressing issues affecting Black communities. And we're really excited to be joined by two absolutely fantastic guests today. Our first guest is Florence Riako Anam. She's co-executive director of the Global Network of People Living with HIV and a leading global HIV advocate. Based in Kenya, she works to ensure the voices of people living with HIV help shape global policy, research, and decision making.
And we're also delighted to have with us Juddy Otti, my boss, the big boss lady. She's a highly respected HIV advocate with more than 15 years experience through her work with AAF as a head of HIV services, and with One Voice Network. She champions the voices of Black communities, migrants with HIV in the UK and abroad.
Wonderful. Two absolutely phenomenal women. And Denis, I've got some exciting news to share.
Oh, wow. What is it?
So today marks the official launch of the year-long HIV prevention programme for Black Londoners, and Skin Like Mine is back. It's the HIV prevention programme by and for Black Londoners, delivered by One Voice Network and funded by Do It London. And we're going to be building on our work over the 4-month interim programme, where we engaged over 1,500 Black Londoners. And we took HIV testing directly into the community all across London, combining HIV testing and prevention with lots of other engaging activities like spoken word poetry events and beauty makeovers. But I think one of the most important things of the work of Skin Like Mine was the conversations that we were having with people, recognizing that people from Black communities face significant barriers to HIV prevention, including systemic racism. But by providing clear, accurate, culturally relevant information in trusted spaces, we were empowering people with knowledge to make decisions that are right for them. And one of the things that I'm really excited about is that African Advocacy Foundation is one of the partners delivering the project now. So I'm really excited of working with you on it. But Denis, why do you think that this program is so important?
I think that it's a great news that One Voice Network Collective is going to deliver Skin Like Mine Phase 2. I think it speaks to what the report Reimagining HIV Prevention in Black Heritage Communities in London highlighted, which I believe is what Ovian is addressing. And this was late diagnosis of HIV, lack of PrEP awareness, digital exclusion, stigma, and perceived low risk of HIV, as well as letting communities lead on the work on issues that affect them. And I think it's a great opportunity for One Voice Network to enhance the excellent work done on the first phase of this program. So we want to thank the London HIV Commissioners, particularly Mark Thompson and Piers Johnson, for the work that they have done with OVN to do this.
Wonderful. And thank you to Christy, who's been really fantastic with all of the comms. And I'm so excited to be working with everyone on this. So keep an eye out, Londoners, for what we have in store. But shall we bring on our first guest, Florence?
Absolutely.
Okay, buffering. She's coming. I can see that Florence is joining us from Kenya. Is that where you're from, Denis?
Yeah, originally from Kenya, Western Kenya to be precise. And Florence actually is a girl of the soil from where I come from. So it was, so it's like the lakeside of.
Okay. Yeah. And as we are having a bit of trouble with Florence, can we bring on Judy?
Yep. Yes.
Let us see. Ha ha! Hello, Judy. Thank you.
Hello, Susan. Hello, Denis.
Hi, Judy. Lovely to see you.
Hi. Wonderful.
Boss lady speaking.
Yeah, loving the boss lady. So, Judy, one of the highlights of last week for me was attending the launch of the HIV Patient Charter by One Voice Network, an absolutely fantastic event that you spoke at. But you've played a really important role in developing it. Can you tell us a little bit about it?
Sure, Susan. And that's one piece of work I'm very proud of at the moment. This was a result of a consultation we did that created a report, the primary care report that was looking at experiences of Black people living with HIV in primary care. And that report was a partnership between One Voice Network and National AIDS Trust that produced some key findings, including barriers that were experienced by Black people accessing HIV, accessing primary care, inequalities, stigma, lack of culturally competent services, as well as the disengagement of Black people from their GPs or inadequate services that they were receiving. So through that report, or by that report, that's what gave birth to the Patient Charter, trying to understand how we can come up with something that can support Black people as they access services. We recognize that Black people living with HIV face very unique barriers, which include structural barriers, racism, stigma, all these things, the inequalities that we see every day. And this charter really helps outline the rights and responsibilities to ensure that one receives the care that they deserve and are aware about what they're entitled to.
Amazing. So Judy, I know this, so I've worked with you on this for some time, and I know it's really all about system changes. We know that, the inequalities we see, some of them are very systemic in nature. So what are the key messages in this charter that you think will make the biggest difference for Black communities? Because, systems are always challenging by their nature, and I just want to know what you think are the key takeaways on this charter that will make a difference for people in the UK who are Black who are living with HIV.
Thank you, Denis. And for us, it was very important that we made sure it was practical and it reflected the needs and resonated with the people we are designing it for. So we co-produced it with people with lived experience, community organizations, and HIV GP champions, so that we made sure we're not too ambiguous with our plans. And it came up with 8 key actions that we are saying what you should expect. And they're simplified so that they can be easily understood. So we've got respect and dignity, making sure that you are treated with respect and dignity as you access services, making sure that these services reflect your identity, and that means they should be culturally competent or sensitive, your immigration, your background, your faith, your gender, those are very key aspects to make sure that that is reflected. You should expect that the services are equitable so that you have access to all, including not just your primary care, but vaccinations, health checks, screenings, onward long-term treatment, to make sure that you actually have access to that. The access to confidentiality and safety, making sure that there's data not shared without your knowledge, unless it's for your safety or the safety of others, understanding that you have a key role to know who has access to your data and control how that is used. Making sure that you have the information in relevant and clear ways. So if it needs translation, and sometimes we have to be cautious, it's not just written translation, audio translations is also key. And making sure that its services are stigma-free. And this one, when Denis, you asked me, the key stigma-free is something we are battling for a long time. And just making sure that people are treated with dignity and equality, free from racism, HIV stigma, homophobia, sexism, stereotypes, really making sure it's lack of judgment, making sure you're included in all your decision making, so shared decision making, that your voice is heard, that your feedback is listened to, that it's patient-centered is key. And the last one was making sure you have a holistic support. So it's not just the medical and the clinical. If you have issues around family, around housing, around poverty or benefits, that there is a social prescriber who can help you access outside clinical services. The key thing is that it was not just about these facts, but what happens if things don't go the way they should. That was something that was very key, knowing what to do when things go wrong. Where do you go to? The channels of trying to resolve that and getting the help that you need. But not forgetting, if they do go right, please celebrate them, share them. That was very key from the GP champions. We don't only want to hear when things go wrong. So please also share when things go right. Thank you.
That's amazing. Very quick one. So what is the dissemination plan? How are the GPs and primary care going to access this report? Is there some commitment for them to use it?
So what we are planning to do is have endorsements by different GPs, surgeries to endorse the charter. We are going to launch the charter in north of England and in Scotland, and we've done a pre-launch in Wales, but we are going to do a bespoke charter for Wales. And we are buying in patients to also work with the HIV Confident Charter by NAT, which is endorsed by many of the GP services. So if they can also adopt the patient charter, have it displayed somewhere in their clinics, in the surgeries, hopefully that there's a buy-in from clinics. We are primarily trying to reach people living with HIV so that they feel empowered when they go to see their GP to expect these services that we've outlined in the charter.
Fantastic. That's absolutely amazing. And it's incredible, all the places that you plan to actually get it out. And I'm really glad that you raised that, Denis, because so often we do have these fantastic resources, but then they don't reach the people who really need it. So it's great that you're going to be taking action that everyone can benefit from it. But one of the really important things that you raised was about stigma and the fact that people living with HIV often experience stigma in healthcare settings. But another type of stigma that people regularly face but isn't discussed much is internalized stigma, those feelings of stigma about how HIV may make someone feel. And often people don't really know what to do about that or how to access support. And I'm really excited to be part of Fast Track Cities program again in London to be working to address that. But also AAF are part of that. So Judy, can you tell me about some of your plans to help tackle internalized stigma, particularly for people from Black and migrant communities?
No, thank you very much, Susan. And given our organization, and we really specialize with supporting people of Black heritage, we adopt this through our cultural identities and senses belonging. So we have created a unique opportunity to have a conversational space that allows us to explore these cultural identities and norms and perceptions in relation to health, in relation to HIV, and break those taboos down so that we can tackle internal stigma and the perception we have around having HIV, because this is something we've grown up with, we've seen through generations. And I also have to add that the experiences we had of HIV back in our countries of origin were very negative experiences, and we cannot undermine the impact of that when you're living with HIV. Currently, in a country that is developed with free medication, very good healthcare services, it's almost a default to go back to the fears that you experienced previously. So we're hoping through this program we're able to tackle those, break them down, and help people manage manage their HIV much better by breaking down that internal stigma.
Fantastic.
Yeah. So Judy, what advice would you give somebody who is suffering with self-stigma?
The advice I'd give somebody is seek help. I think sitting in your own space, in your own head, is not going to solve anything. It's better to speak to a professional. There are loads of professionals. I think sometimes a lot of people worry they won't be understood. They will be laughed at, or they'll think they have a mental disorder. But come and speak to professionals like people in AAF who understand these cultural norms and practices that are there that interfere with the clinical beliefs that we have, so that we can support you and you can get the right care that you deserve, that is available for you, and ultimately you live a much better, more productive life.
Wonderful. Thank you so much, Judy. And I very much agree with you. I think very often people don't actually realize that HIV has changed. The reality of HIV today is significantly different to how it used to be. And also having the opportunity to speak to other people living with HIV who've been through a similar journey can be incredibly helpful. And it's fantastic what you're doing at AAF. As part of the partnership at Fast Track Cities London, there are a number of organisations who are offering peer support for different communities. And also at Phoenix Health Movement, we are developing a range of video resources, including in different languages, with people living with HIV, sharing their experiences and talking about the reality of HIV to help tackle feelings of internalized stigma. So anyone watching, keep an eye out. There's going to be lots of videos and events and groups available, and also people can go to the Fast Track Cities Services Finder to find links to so many organizations, both community and health service, and organizations like Phoenix that can help. So thank you so much, Judy, for coming on and for all of the amazing things that you do.
No, thank you. And if you go to, I cannot leave without saying this, if you go to One Voice Network website, you'll be able to see the QR code to the charter, and all our partners. Thank you very much for supporting this.
And you're doing a great job, amazing job coordinating that. So thank you so much, boss lady.
Fantastic.
Thank you for coming.
Here, I'm just trying to show here are all of the amazing partners of One Voice Network doing absolutely incredible work and really showing the power of Black leadership in tackling all of the issues around HIV. So thank you so much, Judy.
Thank
Bye.
you. Bye-bye.
So shall we try bringing Florence on again? Fingers crossed. Hey! Hello, Florence. Thank you so much for coming on. How are you? Or I think you're on mute.
You can unmute.
Yeah. Oh, yay! Hey, Florence. Wonderful to have you. So let's jump straight in there. Florence, I've been incredibly impressed to see that you spoke at the UN high-level meeting on HIV. Kudos to you. What came out of the meeting that people with HIV should know? Oh, we still can't hear you. I'm not sure. I think you have unmuted. We still can't hear you. What I recommend is maybe if you just pop off again and come back on, and then hello?
If you exit.
Let's hear you. Can we hear you? We can't hear you. I recommend that you just log off and then log back on, and we will sort this out. And there's someone from Wonderful Disruptive Live who can help in the background. But something else that I wanted to talk about that Judy was discussing was the stigma that people face in healthcare systems. I think particularly from people from Black communities, that's very often. And one of the issues that comes up a lot is people being asked about how they got HIV and things like that. And that was something that actually happened to me just in Croydon. Just the other day, I was seeing a urologist, and he said to me,
2026?
In 2026, he said to me, so how did you get HIV? And I said, well, how is that relevant? And he said, well, you know, it could help with the sort of treatment I give you. And I said, could you explain how that's possible? And then he said, oh, well, actually, no, it isn't really. But, you know, it's really for his interest. And I said, well, really, you know, it's really stigmatizing.
But that underlines how much ignorance is still out there, even in clinical settings and amongst clinical professionals whom you think would, bother to do something to learn about HIV. And you see all these very ridiculous sort of interactions that a lot of people from Black communities are having with the professionals in care that are just not supposed to be happening in this era, in this day and age. It's just
absolutely crazy. It's really shocking. And I said to him, it was inappropriate. He should actually find out more, like HIV Confident program that National AIDS Trust are working on with Positively UK. And guess what he said to me? He said, oh, you know what? You don't need to make such a fuss. You could just say that you didn't want to say. And that really, really.
That's rude. That's shocking. That's shocking.
Yeah.
I mean, and you can imagine you handled it with a lot of, you're confident, obviously, and you handled it very nicely. Imagine if they asked that to somebody who has very little confidence, who are probably, they would never go back. And this is like really
exactly. So do better, healthcare professionals, but find out more from HIV Confident Charter. But I think that Florence is back, so let's bring back Florence.
Amazing.
Hello, Florence.
I don't know if you can hear me.
Yes, fantastic. We can hear you. Yay! We're overcoming these technical difficulties. So, Florence, can you tell us about the high-level meeting, what people living with HIV should know?
I think if I just jump right into it, one of the things people living with HIV need to know is with the high-level meeting process and the adoption of the political declaration, which was signed by or ascended to by almost 149 countries, we now have the ability to implement the global AIDS strategy. With UNAIDS leadership, and I think I must stop here and say it's been incredible to watch UNAIDS leadership throughout this process. At the start of this year, we did not even know if we will have a political declaration. Remember, last year we were all disrupted, and everyone kept wondering, why does UNAIDS have to organize us around developing a global AIDS strategy when we don't even know what will be happening in the future? And they're sunsetting. And I think for me, the unique leadership decision to keep us going, even in these moments of disruptions and uncertainty, has gotten us to this point at which we can all anchor our work right now on the current Global AIDS Strategy 2026 to 2031. So the unique leadership of UNAIDS, of various community people, of different partners and donors and governments have committed to working together towards HIV response, to getting to the global goal of ending AIDS as an epidemic, public health threat by 2030. And of course, the discussions around 2031 and beyond are in here as well. Yes.
That's amazing, Florence. But every strategy has to be backed by finance, and we've seen significant cuts in HIV, for global HIV funding over the past year. And I just wanted to know from you what impact this is having on people living with HIV in African countries, and if indeed this global HIV strategy can be achieved with those, the impact of these cuts.
Yes, you're right. I think I want to read from something that I'm using as a point of reference right now, because I think the disruption has also gone through different, I think, episodes. It's like this bad movie that has these different episodes. But CHI, the Clinton Health Access Foundation, Access Initiative, together with UNITAID, have been releasing what they call the HIV Market Impact Report. So from their report in June, that looked at several countries in Africa and Asia, these are some of the statistics about the impact of these funding disruptions. So PrEP initiations fell by 42%, HIV testing dropped by 12%, while new HIV positive diagnosis dropped by 28%, and viral load testing declined by 21%. Children are left behind in ways that should worry us all. ART initiations for children dropped by 15%, and in total, 11% of children fell off ART. So that makes it even, the number that was already less, 26,000 children further left behind on treatment. So what this has resulted in practically is prevention services have fallen off. Treatment disruption has happened, and I think the full and honest reality of what that disruption with the shift in the health services will look like, we will begin to see, because remember, the data was also disrupted. So we will begin to see that as we begin to monitor advanced HIV disease. I think the other important thing to understand is community interventions have been hard hit. HIV is a unique disease. We didn't make it unique. We got here and we found a disease that is already framed as this or that makes it difficult to live with HIV, to go forward and get testing or get prevention. And so the needs that community services organized and promoted for prevention, for testing, for support, for adherence, have been now cut off. And the implication is networks don't have money, community organizations don't have, the ability to continue in their work. In the shifts that are currently happening in our countries, the first thing to kick out of the list in priorities is, of course, community interventions, because it's now moving more towards public health service delivery and less towards the actions at community level. So even though in the political declaration, there's a lot of mention of the role of communities and the importance of communities, what I find largely missing is who will fund it, in what mechanisms. And so long as these disruptions continue, I think we will continue to see this happening.
Gosh. Thank you so much for sharing that, Florence. It's really harrowing, and it's awful that, as always, communities are facing the brunt of the disruptions. But as we look to the past, we can see the power of community action, and it was communities that actually led to HIV treatment being available in the first place really wildly. So community leadership is incredibly important, and I'd like to take my hat off to you, Florence, for everything that you are doing for people living with HIV globally. You're a true inspiration. So thank you so much.
Yeah.
And unfortunately, that's all we have time for with our 30 minutes. So thank you very much, Florence, for coming on the show.
Thank you so much for having me.
It's been wonderful. So so despite the technical issues that we've had, I think that was a really interesting and important conversation, and very much shows the power of community leadership. So I would like to thank Disruptive Live for their technical wizardry, making all of this happen despite, some internet issues that some people were having.
And thank you so much, Florence and Judy, for coming to the show. You are very fantastic, and we can't wait to have you another time here.
Absolutely. And audience, if you enjoyed Positive Health, you can watch all episodes on the Phoenix Health Movement YouTube channel. And I encourage you to like and subscribe and tell all of your friends all about it. We will be back in 6 weeks' time. We'll also be sharing some of the things that happened at the AIDS conference. Denis, will you be there in Rio?
I will be in Rio and look forward to meeting you there and interacting with all global advocates. So we'll have a lot to tell you when we come back.
Fantastic. So I'll see you from the other side of Rio. Thank you very much, everyone. Thanks for watching. Bye.